This is not just an OH&S issue, this is not just another cross-department committee. It's actually fundamental to the business why we see people, to see if we're actually making a difference to them, see if we're treating the most severe, to see if we're helping people get better from our perspective, from their perspective.
It's about making it relevant to the staff in the sense that it's a valid way of looking at progress, and it's a valid way of engaging people around their progress or otherwise.
The amount of work that goes into parents and kids, adolescents, completing this information, I just think it's disrespectful if we don't use it, but more so than that, for clinicians, team leaders, consultants to draw a conclusion that this doesn't help at all, it's kind of bizarre unless it's actually being included in the team reviews. If you don't use it in there, you'll never discover the value of it.
As part of orientation for new staff to our ward, so that included medical students, nursing students, RMOs, interns, new nursing staff, they all have about an hour session around outcome measures. So we talk very early in their time into the ward how important outcome measures are. That's brought a big cultural shift where we've put it as a priority in our day-to-day practice in the ward.
There are more and more people who are finding ways of using outcome measures. So there are now, you can now, with phone calls or checking through the web or looking at conference sites, you can find people who've actually done something. So you should talk to someone who's got it working. Get a partner, a buddy is important. Be clear who's going to collect the outcome measures is one thing, but also be clear about how the outcome measures are going to be talked about and communicated.
You get that buy-in from the management team. It's then very much about setting that standard and that expectation in terms of this is the process that we are going to be using.
It's easy to overlook the importance of having someone to focus on just the system. And that might be an administrative person, it might be a team leader, it might be a nursing unit manager, but someone who actually takes the responsibility of checking that the measures are done, and also that if you do get feedback reports, either about compliance or about scores, those feedback reports go back to the right person.
We are now beginning to have laptops in our clinical meetings that are live so that we can bring up data. And I think, again, psychiatry's been a bit slow in that area, but it's beginning to happen, because again, I think that if you're having a discussion and you can tap straight into outcome measures, then drag them back into a recovery plan, integrate them so that it's all happening at the time.
Services don't do enough is look at the competencies around routine outcome measures and the fact that clinicians do need refreshers and do need to be retrained.
You need at least a few people in a team who are prepared to put the outcomes on the table. For that, it doesn't have to be the team leader, but it certainly helps. It actually can be a number of junior staff doing it, so long as they can support each other in doing it. It helps to have the consultant be interested and be curious about it. It helps for it not to become the butt of jokes or to be seen as the paperwork exercise before you move on to the real therapeutic material. In fact, I go as far as to say there actually has to be a therapeutic attitude towards all the material that's presented in a team review, and that includes the outcomes as well as every other piece of information.
So 12 to 18 months ago, these were demons, these were additions, and what we've been able to do is, I think, incorporate them in a really helpful way, a non-threatening way, and a dynamic way that enables the staff to see that there is some utility to these.
The registrars and the interns were very interested in outcome measures because predominantly they'd come from general health, where they were used to measuring things and having outcomes.
But in time, the staff benefited from it. They actually enjoyed the interaction, the dialogue it would create.
Just part of what we do here, our ACN shows you how to do it when you start, and you're expected to do it every 3 months when you're doing your recovery plan, so it just becomes tied into part of the work.